Right. So good evening and Ramadan Kareem. I'm Dr. Shaziya Hassan Ali and I'm an oncoplastic breast surgeon. So today we're going to talk about early detection of breast cancer. So I think the first question that everyone asks is why should I learn about breast cancer? And breast cancer is very scary. It's a death sentence. And what is breast awareness really? So that's some of the questions that I'm hoping to answer in this talk. So breast cancer is it's the most common cancer in women worldwide. So this is the picture that I show in almost all my talks really. So 1 in 8 women will develop breast cancer. So 1 in 8 is nothing really. So just imagine you're sitting among a group of women really, your mom, your sister, your aunts, your friends, your cousins. One of them, so if you're sitting among a group of 8 women, one of them will develop breast cancer. And that is scary, but it's definitely not a death sentence. So if breast cancer is caught early, in its very early stages, it's treatable and curable. And what does that really mean? So what I'm talking about is, say, unfortunately, you do develop breast cancer, and then we treat you. At the end of that treatment, you become cancer-free. And I think that's not a death sentence, actually. That is just you going back to having your life. And that's moving on. You forget about breast cancer, but this is possible only if breast cancer is caught in its early stages. So what is breast awareness? And it's exactly what that term says. It's becoming aware of your own breast. So how to examine your breast, when to examine it, how often to examine, what to look out for, and what can I do to reduce my risk? And I'm hoping these are the questions hopefully we'll come across through the next slides. Before we go to the next slide, let me just remember, if anyone has any questions, now unfortunately you can't talk directly to me, but there is a Q&A box in your, I think it's at the bottom of your computer or your mobile. There's a Q&A and they just type in your questions. Doesn't matter if it's the most silliest question or if it's really, really embarrassing questions. I think you can go anonymous. We're all here to learn and educate ourselves. So pop in the questions and I'll answer them at the end of the session. All right, so let's move on. So before we try to understand what is breast cancer, I want to talk a bit about the myths and facts that's over there. There's a lot of information out there, what to believe, what not to believe, isn't it? So the first myth that I come across, a lot of people ask me this: I am very young and I don't get breast cancer. It's someone old. It's maybe it's my mom or my aunt or my grandmom's. I'm young. I shouldn't get breast cancer. That's completely wrong. Women of any age can get breast cancer. The only difference is if you are between the age group of 50 to 65, you're at a higher risk of getting breast cancer. And if you're at the age of 30 to 50, you know what? It's still the incidence, how many people are getting breast cancer, it's increasing. Below 30, yes, it's rare, it's uncommon, but again, we are seeing breast cancer even in women who are less than 30 years of age. So too young to think about breast cancer? No, you still got to start thinking about breast cancer now. So this is completely wrong. The next myth that I usually come across is, breast cancer only runs in family. So this is like, if my parents had it or if my grandmothers had it, only then I need to worry about it. This is completely wrong. Actually, if you look at all the breast cancer, all of them, everyone in the entire world, only 10% of it is related by family. Everything else, the women just get breast cancer for no reason at all. So this is not true as well. The next thing is, if I have breast cancer, I'll have breast pain. Or it's the other way around. If I have breast pain, then I definitely have breast cancer. Both are wrong. So breast cancer is very peculiar. It does not cause pain until it presents very, very at its late stages. So once it's spread everywhere, that's when it causes pain. It's something very peculiar with breast cancer. And the other bit is, if you have breast pain, Usually it is not breast cancer. This is the, facts that I'm trying to talk to you today. The next thing is, if there is a breast lump, it means that you have breast cancer. So not all lumps are breast cancer. There are many, many, many lumps that's just benign. What I mean by benign is it's not normal, but it's not cancer. It's somewhere in between. It could be something that we can just leave it alone, or it could be something that you need an operation and take it out, but it's not cancer. All right. So not all breast lumps are breast cancer. The next is only women get breast cancer, men don't. Now, unfortunately, men also have breast and men can get breast cancer. It's just that when you compare it with women, it's rare, it's uncommon. That's all. So this, I'm just showing a picture of this man. You can see here, he's got a normal breast there, and he had breast cancer, and we did a mastectomy, which is complete removal of his breast nipple. Okay, so men too can get breast cancer. The next thing is mammogram can cause breast cancer. This is so unfortunate that people believe that. So mammogram is nothing but an X-ray treatment. That's all it is. So say you have a cough or a chest infection, you get a chest X-ray. Say you have, you break your hand, and then, you have an X-ray of your hand, and that's it. So, and when you compare between a chest X-ray or an X-ray of your hand to a mammogram, mammogram has less radiation when you compare it to a normal chest X-ray. So no, mammogram does not cause breast cancer. So there's a lot of myths out there, actually. This breast cancer is contagious. There is nothing you can do to reduce your risk of breast cancer. That is not true. You can do a lot of things. It's caused by a certain type of bra that you wear, or it's because you wear deodorant. That is not true. These things have nothing to do with breast cancer. I can't talk about breast cancer to anyone. This is a very common one. You feel that this is something you need to, it's your journey, and then you can't talk about it to anyone. That's not true either. I think you have to be open about it. Talking about breast is a taboo. It's not. I think the more you start talking about this in a group of women, when you're outside, you talk to your mom, your sister, your friends, talking about your breast should be the norm and not a taboo. So, like I said, there's a lot of information out there. How are you going to decide what's true and what's not? And we all know where we get our information from, isn't it? We get it from WhatsApp, from media, from magazines, movies, family, friends, Google, all sorts. Now, I would really suggest against using any of these things that I have mentioned in trying to get information about breast cancer. I'm not just breast cancer, anything, breast pain, breast lump. So this is a very good website. It's called breastcancernow.org. And everything is explained in a very, very, in a normal English that everyone can understand. And, you have problems with your breast pain, you can read about it. It's free. And you have any breast lumps, you can read about it. You have breast cancer, you can read about it. I think it's very, 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 very patient and people friendly. So I think if you want to learn about anything about your breast, go to Breast Cancer Now. That's where you should be getting your facts. So let's come to some facts, isn't it? So what is breast cancer? So I have put down, I'm trying to explain it in the most simplest way that I can. So there are two pictures here. One, this is how the normal cells in your breast is arranged, neatly, nicely, and tightly packed. This one is, so this is cancer basically. So these are how abnormal cells, they are destroying all the normal cells that's over there, and it grows, it multiplies. So basically, what is breast cancer? It's uncontrolled and unregulated growth of cells. So it's something that we cannot control. It grows, it multiplies within the breast. And then when it goes out of the breast, it spreads, obviously. So it's very common. It is one of the leading causes of death in women. But like I said, breast cancer shouldn't be scary. It's just that if we find it early, in its early stages, it's treatable, it's curable, and we can make you cancer-free. Okay. So who can have breast cancer? This is again, breast cancer can affect anyone, all women, even men. So some people, some women, they are more prone to develop breast cancer, and we call this as high risk factors. So I will try to tell you what the high risk factors are, and I've tried to put them in two groups really. One is modifiable. What that means is you have certain risk factors for breast cancer, but you can change it. These are things that you can do to prevent cancer coming to you. And the others are unfortunately non-modifiable. That means these are things about you that you cannot change. So the modifiable risk factors give us an opportunity to give breast cancer, to prevent breast cancer to a greater extent. So what are those? So I have just put them in two groups really. So the first is non-modifiable. So these are things about you that you can't change. You can't change that you're a woman. You can't change your age. You can't change your genetic factors. Like if you have, family history, someone in your family have breast cancer, someone in your family have, cancer of your ovaries. You can't change that, can you? Your personal history, you can't change that. Your menstrual history, when you got your periods, when your periods stopped, you can't change that. Your race, are you an English or are you an Indian woman or you're a Pakistani woman or you're an Emirati? You can't change that. So these are the things that you can't change. But this is the bit that I would like to talk to you about. What are the things that you can do, that you can change? What are the things that you can reduce your risk of breast cancer? So first thing, not having children is something related to breast cancer. So what studies have shown is pregnancy and breastfeeding, they prevent breast cancer. So older age, so that is increased age at the first childbirth. So how old you are when you had your first child increases your risk of breast cancer. Hormone replacement therapies, these are medications that you use during the changeover period, when you have periods and then when your periods stop. It's called perimenopausal or postmenopausal, that you experience a lot of changes in your body, and then some women take treatment for that. That's hormone replacement therapy. It contains a lot of hormones like estrogen, and that causes that can increase your risk of breast cancer. So not breastfeeding, like I said, breastfeed your children for at least a year or two. Using alcohol, being on the heavier weight side, and not having any physical activity. So these are the things that we can change, isn't it? So what can you do? Try to maintain a healthy weight. So take, at least 150 minutes of moderate physical activity over a week. And this is really nothing. It's just, an hour every week. That should do it really, walking, running, exercising, whatever you do, your Pilates, your yoga, whatever, just do some sort of a physical activity. Try not to drink. Breastfeed your child for a year or two, but not longer. Because I've had a patient who's come to me and breastfed the child for like 4 years. And I'm like, no, that's not what we mean. Avoid hormone replacement therapy. So try not to take any of these hormonal tablets. Avoid unnecessary exposure to radiation. Don't smoke. Be aware of your breast. And I will talk on that breast awareness more later. And this is an important bit actually, make cancer screening a part of your life. We make so many things part of our life, isn't it? Like grocery shopping, that's something that we have to do every week. And, make this too, being breast aware, being aware of, examining your breast, a part of your life. So a couple of things to remember is there is no sure way to prevent breast cancer, but there is so many things that you can do, just like the things that I've mentioned here, to reduce your risk of breast cancer. So let's talk about diet and exercise. And I think this is really important. It's a very important aspect nowadays, especially during COVID, many of us have put on weight. It has reduced your physical activity because we were not allowed to go out, isn't it? So a healthy, balanced diet, regular physical exercises and activity will help to maintain one's, body weight. So obesity, for some reason, it increases your estrogen hormone in your body. And what that does is it's like sugar to ants, it's just increased risk of breast cancer. And it's also important to take, have a balanced diet. So, fresh fruits, vegetables, It not only prevents cancer, prevents all sorts of diseases, heart diseases, diabetes, stroke, everything. So that's good. But the problem with all these, consuming from your market it's that it'll be loaded with pesticides. So make sure, I always say, we don't know what is the impact of having all these chemicals into our body. So wash your veggies, wash your vegetables, and, hopefully it will prevent a lot of diseases actually. So if you do have someone in your family who's got breast or ovarian cancer, now this is something you have to do. You must consult a doctor. All right. And this is for, what is the doctor going to do basically? So it's just going to assess what is your risk of getting breast cancer in your lifetime. So what can you do? These are the couple of things that the doctor can talk to you. They can talk to you probably about taking a blood test to see if you have a gene, a genetic problem. They can give you medications. They can, tell you that, do you want to do surgery to take your breast, to remove your breast? This is something Angelina Jolie, our very famous actress, have done. She found out that she had the genetic, gene for breast cancer, and then she removed her breast. So this is something that you can have. It's not that you have to do, but, it's a discussion that you can have with your doctor. And if you don't want to have surgery, if you don't want to remove your breast, then what the other thing that doctor can do is screening, have your mammograms at an early age. So if you do have someone in your family, I think you must consult a doctor and just discuss your options. Right, so let's talk about what can you do. You must, I feel, ladies, you should be aware about your own breast. You should get used to looking at them. You should, feeling your breast should be something that you feel regularly, something that you do regularly. So a good time to do this is when you're in the bath, you're taking a shower, or even if you're lying down, you're sleeping, it's fine, honestly, it's completely fine. There's no special way to check your breast. You don't need any training for that. Everyone can examine the breast that I'm going to demonstrate today. Everyone can do that. So everyone will have their own way of touching and looking for changes. So you don't have to be, so someone says, oh, this is how I examine. That's fine. You examine your way, whatever is acceptable to you, that's fine. So 20 years and above, anyone who's 20 years old and above must examine their breast. So usually to examine would be about 5 days after your periods. Your periods, your breasts are swollen, they must be tender, they must be having breast pain anyway. So don't examine then, examine 5 days after your periods. Now, or if that's quite difficult to, remember and all of that, just keep a date in your calendar. We all have smartphones. We all have calendar, or we have a diary or whatever. First of every month, just examine your breast. So that's all I recommend. Once every month. You don't have to do this every day. You don't have to do this every week. Just once a month, ladies, and that's all you have to do. Right. So a couple of things. You can look in the mirror. You can raise your arms. You can lie down. You can examine while you're showering. It doesn't matter. Just do whatever you're comfortable with. Now I have something here and I hope everyone can see. If you can stop looking at the screen and start looking at me. So I have something here. It's just a breast mold really. So what I want you to do is, I don't want you to keep poking your breast like that. That's not how you examine it. What I want you to do is use the palm of your fingers. Okay. And I want you to start from the middle and go out like that. Do you get me? That's how you do it. And make sure you examine all the sides there, everywhere. And so that's not it. I see some people, examining the breast like this. That's not enough. That's not enough. This is not enough. It's using the palm. All right. And then use it all around it. And then you do the same for the other breast. So let's go to the next slide. So, right. So you've examined. What are the things you're looking for? Any lump. Now, how are you going to feel a lump is there? So honestly, when you feel that, so this is why it's important that you examine your breast once every month. So you know what your normal breast feels like. So if anything you feel that's not normal for you, you have to get it checked out. So a lump can be like, you feel like a ball inside your breast. Any changes to the skin? So any changes like, the skin's gone in, anything, any change in color, any change in appearance, the nipple's gone in, or the nipple's changed in color, or the nipple is leaking, what we call nipple discharge, any of that. Change in the size of the breast is smaller, or you feel the breast is bigger, or it's looking at an odd shape, it's moving that way, or it's moving this way, get it checked. So these are the things that you're going to look for. Well, oh, I feel we have missed a couple of things, right? So what happens? You've examined your breast, you've gone to the doctors. What is the doctor going to do? The doctor is also going to examine you, and then you have a mammogram. So if you're 40 years old and above, you get a mammogram. If you're below 40, then you get an ultrasound scan. So mammogram does not cause breast cancer. I think we have established that. What mammogram does is it detects cancer before even you can feel it. So what I'm trying to say is that if you feel a lump in your breast, it's already grown to a certain size for you to feel it. Now, if you do mammograms regularly, mammogram can pick up these lumps even before you can feel it. So when it's really, 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 really tiny. So that's what we want. We want to catch it when it's in its early stages. Okay. So you have your mammogram, and that's what, yeah. So I've just told you about mammogram. It's not painful. It could be a bit uncomfortable, and that's all I'll say, because you get your breast squished between two plates that you can see, but it's not painful. It's just an X-ray, and that's all it is. So then you have your core biopsy. Again, it's just a needle biopsy. We women have had many other things done to us by many other people, including doctors. If you've had your delivery, if you've had babies, the core biopsy pain is nothing. We do numb that area. So what you usually do is you give a small injection there, numb that area so you don't feel anything, and then that needle goes in for a biopsy. It's a very, very easy procedure, and it's usually very painless if it's done properly. So I'm not going to talk a lot about treatment, because this talk is more about getting you to examine your breast and then go and have your mammograms if you're 40 and above. So I'm not going to tell a lot about this treatment, but if you do have a lump and that's unfortunately come back as breast cancer, then what we do is surgery. So I would like to highlight that not everyone loses their breast. So if it is caught early in its small stages, then we can do what we call a lumpectomy. The lumpectomy is where we just remove a portion of your breast, the rest of your breast, the nipple, areola, all that remains. Okay. Unfortunately, yes, if it is caught in its midway stages or later stages, you need something what's called a mastectomy. That is complete removal of the breast. But I feel that's fine. I mean, we women are not just all about our breast, isn't it? If you do have a mastectomy, it's fine. It's not the end of the world. So I have something here that I want to show you. It's called breast reconstruction. So again, if you can look at my screen and not at the my slideshow. So I have something here, and I hope you can see. So this is a breast implant. Okay, it's a breast implant. You can see it's very soft. It's very, can you look at that? It's very squishy. And what we do is you have a mastectomy, we lift the skin off, put that in, and then close your skin. So you have something as a breast, or something you can, call as a breast, really. So I just wanted to show you that, right? So breast reconstruction, it's something that I feel every woman should be offered if they're having their mastectomies. You should be going and seeing a doctor or a center where they offer breast reconstruction. Chemotherapy, again, not everyone needs it. Chemotherapy is drug that is given into your veins with a lot of side effects, but not everyone needs it. And that's very, very important to understand. Can you imagine a time where a woman is diagnosed with breast cancer and they don't need chemotherapy or radiotherapy? When that happens when we catch breast cancer in its early stages, when it's really, really tiny, time when even you can't feel it. It's found by the mammogram. That's when you don't need chemotherapy. Sometimes you don't even need radiotherapy. What is radiotherapy? Radiotherapy is just X-ray treatment to your breast. That's all it is. And then you have your hormone therapy. So I'm not going to talk a lot about different treatments and all that. I don't think that's what this talk is about. It's about you examining your breast and getting your mammograms done. So also remember, I have put it down as surgery, chemo, radio. It's not always in that order. So sometimes you may need chemotherapy first, or sometimes you might even need hormone therapy first. We give you a tablet, you take it for a couple of months, and then we do your surgery. So things will change. And that's why it's so important to get it right the first time. So the first doctor that you go to, it's so important that you get it right the first time. So I would always recommend that if you do have a breast lump, you go to a breast surgeon. But I do understand that not everywhere you have breast surgeons. So then your next best option is going to a surgical oncologist. What we call it, it might be called surgical oncology. It can be called just oncology. Oncology doctor will be fine. Then your third best would be general surgeons. But again, the only thing I would like to mention about general surgeons is they do cancer surgery, but they don't do breast reconstruction. Okay, so they don't do plastic surgery. Gynecologists, I've written it there as gynecologists because gynecologists are doctors who see and examine a lot of women, isn't it? So gynecologists, it's fine, you go, but as long as they do the referral in time, because they don't do cancer surgeries, do they, for breast? So first would be breast surgeons. The second best would be surgical oncologist. So I feel, I've just put this slide, there's so many roles that we play as a woman. We are a mother, we are a sister, we are a friend, we are an aunt. And on top of that, we are also teachers, we are artists, we are painters. And on top of that, we are also cooks, we are cleaners, we are so many things. We have so many roles and we are all Wonder Women. But to complete that role, you need to be alive, isn't it? So you've got to. And this is something I would like to say, that even a Wonder Woman have to examine the breast. So even if you're doing your cooking, you're cleaning, you're looking after your kids, you're doing your education, you're going to college, you're hanging out with your friends, you have to find the time to examine your breast. So a couple of take-home messages. The first thing I would like to say is that breast cancer is curable. You can be cancer-free at the end of your treatment. So it is treatable when it is in its, I've just put it, even if it is its last stages. Now, at the moment, if you feel someone who's got a breast lump and who's reluctant to go to the hospital, and you think, oh my God, they might be in the late stages, it's fine. Just get yourself to the doctor. It's still treatable. Breast cancer is still treatable, okay? So a form of effective treatment, I've just put this again, to treat breast cancer, you need your medical oncologist, you need your radiation oncologist, you need an oncologist, which is why it's very important that you go to a hospital that has oncology department. So get it right the first time, go to the right doctor the first time. Stay calm, stay positive, and never lose hope. I hope you enjoy the talk, and let's look for some questions and answers. Right. So I can't see any questions yet, but feel free to type them. I don't mind. I'm happy to wait. Shall put, I think we have about 10 minutes or so. Right. So I got the first question asking, what does a breast lump feel like? So if I were to say, so can you feel a rock or a bowl? So just imagine you're examining your breast. You're doing that, okay? And then you feel something that you can roll within your breast. You feel something that you can roll it. And then you can push it. It's like, we call it a mouse in the breast, really. So if you can roll it and it feels hard, so your breast should feel, so I'm just going to, if you can just look at me and then say, so if you feel that, can you feel that with your finger? We say that's hard, okay? Now, can you feel that, the tip of your nose? We call it firm. So anything that feels really hard like that, or firm like the tip of your nose, that's something that needs to be investigated. I hope that answered your question. Right. So the next question is, I had breast cancer history. My mother had, and I'm of 25 years, and I should take doctor's opinion, definitely. So I would say your next best thing for you to do is go either to a surgical oncologist or go to a genetics doctor. So what the genetics doctor will do is the doctor will take your history. So when did your mom had breast cancer? What type of breast cancer? What treatments she's had? And then will suggest that you do a blood test to check what are your probability, what is your chance of getting breast cancer. So definitely you should take a doctor's opinion. If you can, try going to a surgical oncologist. If you can't, try going to a genetics. And if there is no one really around, just go to general surgery doctor. That's fine too. But definitely you should take an opinion to find out what's your risk. Right. So the next question is pain a symptom of breast cancer? No, it's not. So if you have, so I'll talk about two things here. So one thing is all you have is a breast pain. Okay. That is usually very, very, very unlikely to be related to breast cancer. Now, breast pain is very common of ladies of all ages. It's very, very common. Why do you have breast pain? Because you're a woman and you have hormones called estrogen, and you have estrogen imbalance, and that happens because of a lot of reason. And then that's just it really. It's just hormonal changes, and that's causing breast pain. That's it. Now, let's say you have a lump and you have breast pain. That's fine too. That's also very, very unlikely it's going to be a breast cancer. But if you have a breast lump and a breast pain, I would suggest you go to a doctor, get your mammogram and ultrasound scan, and then see what that lump is. Usually it's a benign lump. What I say is benign is something that's not normal, that's not cancer, it's somewhere in between. But it is, it's usually treatable, and, it's just nothing really. You can just leave it alone sometimes. The second thing is, if you have breast cancer and it's at its late stages, it's called really early. I mean, really late, like it's gone to your lymph glands, it's gone elsewhere in your body, and that's when you have a pain, then yeah, you can have breast pain. But if it's just breast pain alone, then very, 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 very unlikely. So let's look at, so at what stage is surgery inevitable? So surgery is inevitable when it has gone elsewhere in your body, not when it's gone to your lymph glands. So we all have lymph glands here, not that. When it's gone to your lung, your brain, your liver, your bones, then that's stage 4 cancer. Unfortunately, at stage 4 breast cancer, there is no role in surgery. It'll be the oncologist who takes care of your further management. So that's what we don't want. We don't want you to come to us when you're stage 4. We want you to come when it's stage 1. Just really, really, really tiny, seen on a mammogram. Right. So there are different categories of breast cancer. Can you explain about that? So different categories. I just want to say, so there is, I hope you're asking about stage of breast cancer, and just reply back if you're not talking about stage. So when we talk about stage of breast cancer, there is stage 1, stage 2, stage 3, and stage 4. Now, stage 1 is a breast cancer that's so small that even you can't feel it. It's found on a mammogram or an ultrasound scan, and it's not spread anywhere. That is treatable, curable, you become cancer-free. Stage 2, it's a bit bigger in size. Maybe it's gone to the lymph nodes, but it's still treatable, curable, you become cancer-free after your treatment. Stage 3 is, it's really massive in size. It's more than 5 centimeters. It's gone to your lymph glands, but still, even stage 3 is treatable, curable, and you become cancer-free at the end of it. The last stage is stage 4. Unfortunately, if you're stage 4, it's gone to your brain, your lung, your liver, your bones. You can't become cancer-free. We can treat you, but we can't cure you. It's not a cure. All we are doing is just sort of keeping the tumor at bay. You can never call yourself cancer-free. You can never say you're cured of cancer. And it's one of the last stages, obviously. I hope you're asking about the stages, and if not, just ask again. That's fine. Right. Does unusual growth of your breast size sometimes has something to be taken care of? Right. So ladies, I want to tell you that not every breast is the same. One breast can be small, the other breast can be big. It's fine. They are not sisters. I mean, they're not twins. They are sisters, right? So that's fine. So if one of your breasts is small and the other is big, or they are a bit not same symmetrical, that's fine. So like I said, just keep examining your breast once every month. Be aware of your breast. So if it's something that's new to you and that's abnormal, that is when you gotta examine yourself. So no, unusual growth of your breast size cannot be really breast cancer. It can be normal as well. But if it's something that's new, get it examined and get it checked by the doctor. I think we have about another 5 minutes, maybe. Anyone? Any questions? All happy? Right, so I've got a question. Let's see, what is this? What is the risk of breast cancer in women who's had breast augmentation? So breast augmentation is when ladies have implants in their body, all right? And they've had it done only because either one of the breast is small and you've had it done, or because you're not happy with your breast size and you would like your breast bigger. That's fine. It's your body. Big deal. You have implants. Your risk is still the same like a normal lady. It does not increase your risk at all. Right. So the other question is, how often do men have to examine their breast? Same thing, once a month. Once a month, examine your breast, men. And for you, I would say, if men do develop any symptoms, anything wrong with their nipple, any pain or any breast lump, I would suggest you need to go to the doctor much faster than a woman, because for a woman, they have a lot of breast tissue, isn't it? So even if there is a small cancer and it grows, it still stays within the breast. Whereas for a man, because they are flat and they're very less breast tissue, it can spread quite quickly. So if you do feel anything, please go see your doctor. So examination once a month, that's fine. Oh, there's a chat section. Hang on, let me just see. Right. At what age should we examine ourselves? So if you're 20 years old and above, you have to examine your breast once every month. So, and that's all for all women. And, once every month, just decide when you want to do it. I have a smartphone. I just put it in my calendar, examine your breast. Like I said, examine wherever you like. You want to lie, you're just sitting in a sofa, examine, put your hands up and examine. If you want to lie down while you're sleeping or you are in the shower, just make sure you examine your breast once a month. So anyone who is 20 years and above. Let's see. At what age? Yeah, it's the same question, really. So 20 years and above, keep examining your breast. I think the most important thing is, I keep saying examine your breast, examine. It's for you to understand what your breasts feel like. So the first time you feel your breast, you will be like, ooh, everything feels like a lump. How do you know? That's why keep examining. Keep examining every month. So you will understand, okay, so that's normal for me. That is not a lump. That is just your normal breast tissue. Do you get me? So it's more about you being aware of what is normal to you. What's normal to you might not be what's normal to me. So it's just how you are really. Let's see. Go on, ladies, come on. There can be a lot of questions, just however silly it is, just ask. That's what this is for. It's just an education. Is that all? Hang on a minute. Yes, I think I've answered all that. Right, let's see. There's a last question. Hang on. How can someone manage treatment-related side effects? So I think it really depends on what treatment it is. So are you talking about surgery, because surgery has side effects? Are you talking about chemotherapy? Are you talking about radiotherapy? And I think it's sort of a, I think I need more information on what treatment side effects you're asking about. So you can pop in that question. That's fine. I'll answer that. So the next question is, what are the chances someone below 20 can get it? Very, 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 very rare. Very rare. Unless they have a family history of breast cancer. So if your mom or your dad's mom or your mom's sister or your mom's mom, so anyone who is in your close relative or your children. So if you're, if you are 50 years old and your child, your daughter has breast cancer, then that, risk is high. So anyone in the family, if you have breast cancer, then your risk is a slight higher, but otherwise below 20, it's very rare. It's very rare. I can't say I've seen anyone below 20 really. Manage. Okay, I think we are done for today. Thank you everyone for attending, and I hope it was a good session for you all. And hopefully we'll keep meeting each other again with small breast talks. Have a lovely weekend. Bye.